Student attendance is extremely important because there is a direct correlation between student attendance and student success.
If kids are not in class, if kids are not in school, they typically do not graduate.
It is about providing all of what a child needs. And in today's world, there are lots of needs. Having the clinic here and the accessibility of it means that we can get them seen sooner.
Access to great health care is a problem for a lot of folks. This is a great way to remedy that problem. It keeps my children in classrooms.
School-based health started in 1994, and since then we've expanded 35 sites across 7 counties in western North Carolina.
So we want to be there for the kids where they are the majority of the day. We want to make sure that we're providing those acute care services, chronic care services for potential diseases that might affect a child once they get into adulthood. And we want to make sure that we're also taking care of their mental health needs.
School-based healthcare is not a compromise. It is quality care that is right on your child's campus. We can do acute care visits, flu, strep, COVID concerns, ear infections. We can also do well child checks and health assessments that are needed for students to start school.
The effect and the impact that we have on their life today is going to follow them through. And that's why our quality of care is so high. We want the very best for these kids and for their future, but also their siblings, their parents, the staff members, their spouses, and their kids.
Hello, Mr. Collins, how are you?
We can provide so many things to them that they might not normally be able to get.
No student, no family will ever be deprived of those services that we offer. We provide services based on a sliding fee scale. We also take commercial insurance, private insurance, public insurance. If they don't have any income, then they pay nothing.
Blue Ridge Health is very intentional about honoring the needs of the community and seeing those trends. Behavioral health was not an initial piece of school-based health, but once that they actually saw how impactful that could be to the overall care of a child, behavioral health was actually instituted and has grown immensely. We have family therapy, we have group therapy, and we have medication management, shall that be ever appropriate.
We don't really want to think about before Blue Ridge, right? It was difficult when you do have that student or that family that's at the end of their rope and they feel like they have no more hope. We did not have a great answer for them prior to Blue Ridge coming to be our partner, and now we do.
I had a parent the other day tell me, my child, she has so much confidence. Her anxiety is so much lower. And I just want to say thank you.
Because Blue Ridge Health is so accessible, we can provide education that I feel like can actually be understood by our students, kindergarten up to high school, as well as their parents.
Our goal is to engage with the parents as well. They can register their child to be seen at school-based health right from their phones.
We want to make sure that we're involving the parent so that they know what's going on with their child at school, and their child's health is everyone's first priority.
I have really appreciated having Blue Ridge Health in our schools. Knowing that my child can come to Blue Ridge Health during her school day has given me such peace of mind because I know that she is well taken care of. Blue Ridge Health does an excellent job of communicating test results and things that happen during her checkup. We have had full confidence in her care, in her treatment, which is incredibly helpful as a working mom.
It's an amazing partnership. We officially opened up this great facility this year in November. To know that we have this right here next to the school is a game changer. It's something that, as a principal of almost 20 years, I never thought that I would see in a schoolhouse. We work hand in glove in taking care of our children and our staff and our community.
Our folks are able to highly recommend Blue Ridge Health as a means to be able to receive physicals and vaccinations in order to support a kiddo who is enrolling in school. Having the clinic in our building and being able to get that taken care of in such a timely manner, it is just a wonderful partnerships that helps everyone.
What makes Blue Ridge Health different is that it's all about the community. School-based health ties into the Blue Ridge mission. Everyone should have access to the resources that they need.
There is no other job that I would want to be at. But working with these kids and seeing the difference that you make, this is a safe place for them, and they know that. And they know that when they're here, they're going to be taken care of. When I leave every day, I feel good about what I've done that day.
We have an absolute opportunity to be a huge impact in a child and family's life. And who would not want to exercise that opportunity?
Our families, our school, and Blue Ridge Health. Now that is one amazing triangle. I love Blue Ridge Health. It is an organization that is run by the strength of its people. The impact that it has on our community is amazing.